Welcome back to the Health Edition of Talk Television. I'm Omar Sachedina, and we're talking today about hair loss and hair transplants with Dr. Robert Jones from the Toronto Hair Transplant Center. One of the things we touched on in the intro was stress, the impact of stress on hair loss. Is that a myth, or can it actually affect how quickly you lose your hair?
Well, if you're under a lot of stress, I think you can have temporary hair loss, but it's not going to cause permanent hair loss. So, I mean, if you do find you're losing your hair and you're under a lot of stress, I would say reduce the stress, maybe get on some minoxidil or Rogaine, and it will come back. So it's kind of like in the category with pregnancies and drugs, and a lot of things will cause hair to go into a resting phase, but it will come back because the hair follicles are still there.
You mentioned Rogaine, you mentioned minoxidil. There's things like finasteride, Propecia in pill form as well.
Well,
do those things actually work? Well,
there's two, besides hair transplants, there's two medications that are FDA approved for hair loss. One is minoxidil, and the stuff you get over the counter is 2%. You can get 5 or 6% by prescription, and it definitely, that works. It'll give you more hair. I've even had women that I've given it to that have got it on their cheek when they're sleeping, and they end up with a little bit of hair on their cheek. So it definitely grows a little bit more hair if you use it on a regular basis. The other is the DHT inhibitors like Propecia, or the other one, the newer one out, is dutasteride. And both of these will, about 90% of people that use them lose no further hair, and about 30% will regrow some hair, usually on the crown area. So both of those medications definitely work. And a new thing out too that's just been available over the last year is called PRP. It's where you take out your own blood and you remove the growth factors from your blood and re-inject them into the scalp. I saw a patient today that I did about 2 months ago, and he'd probably regrown about half the hair on his crown from this PRP treatment as well. And it's there's been a ton of studies done over the past year or two on this, and I think it's actually going to be a nice new advance in hair loss over the next few years.
We've got a graphic of the various patterns of balding or hair loss. When we talk about some of the procedures that you've talked about before versus things like Rogaine or Propecia, how do you know whether you should be focusing on those types of solutions or going for things like follicular unit extraction?
Well, for younger patients, I usually recommend medication first, just because future hair loss is so huge. So if I see a guy comes into the office, he's 26 or 27 years of age, he's got such a huge amount of, and he's already losing his hair, he's got such a huge amount of hair that he's going to lose in the next 10 or 15 years. My #1 goal is to try to preserve what he's got. And the way to do that is with Propecia and minoxidil, where if I see a guy that's 45 or 50 that's lost some hair, he's probably lost sort of 3/4 or more of what he's lost. So my main goal then is to replace the hair. So hair transplants definitely work better, and you get a long-term happier patient in somebody that's a little bit older.
So how does that scale work? I'm just wondering if we can put that shot up again.
Yeah.
How does that work, and how is it developed?
Well, I was a doctor back probably 20 or 25 years ago that basically just wanted to sort of monitor the progress of hair loss, and so he put together a Norwood scale and basically showed the normal progression of somebody losing their hair. Now, although that you know, it's interesting just for sort of for charting of patients and everything, hair loss develops at such a different level and at such a different rate in everybody. I've seen lots of patients that lose a lot of hair in their 20s and they stay stable for 20 years. And you see a lot of people that have lost no hair at age 40 or 45, and then they lose a lot in the next 10 or 15 years. So, I mean, that scale is interesting, but you know, you have to take it with a grain of salt as well. Now, there's a separate scale for females, the Ludwig scale. And what women usually do is they don't bald in the same way with a receding hairline. They just have generalized thinning on the top of their head. And again, both of those scales are available through my book as well. You can look at the Norwood and the Ludwig scale there.
And is the term alopecia synonymous with hair loss? Is it the scientific name for hair loss, or is alopecia a specific condition?
Well, alopecia just means losing your hair. Now, the hair loss that the genetic hair loss is called androgenic alopecia, because the cause in males, or in male pattern baldness, androgenic alopecia, is this testosterone, or a byproduct of testosterone, DHT, which causes you to lose your hair. So it definitely, you know, alopecia, and there's all kinds of alopecia. Long list, but by far the most common, 90+%, is androgenic alopecia or male pattern baldness.
All right, let's get to some of those calls right now. Zach is on the line from Toronto. Hi, Zach.
Hi, how you doing?
I'm doing well. What's your question for the doctor?
If the donor area is not as rich as it should be, could a person still qualify for a transplant to the crown area?
That's a good question, because I think basically what the caller's talking about is basically taking hair maybe from the back of the head and putting it. But we just spoke on at the intro about taking from other areas and using that instead. Would that still work?
Well, you see, body hair transplants really, in most cases, are not effective. We usually save those for people that need repair work, like if they've had other issues in the past. But somebody that's coming with a virgin scalp, you wouldn't want to sort of restore their whole head with body hair, because body hair just doesn't grow the same. It doesn't grow as long. It's not as effective. So the question basically is the ideal candidate for a hair transplant is somebody with a thick, full donor site and a smaller area to cover on top. And if you don't have a thick, permanent donor area, you're usually not a great candidate for a hair transplant, unless you have, a larger, thinner area. But with a small, thin donor area and thin hairs on the back, I always compare it, say to patients, it's like thick hair or thick shaft diameter of hair is like looking at a forest with big trees versus little trees. And little trees you just see right through. So you're just not going to get the same effect if you've got thin hair in the back. All
right, let's get to Michelle now from Toronto. Hi, Michelle. Michelle on the line?
Yes. Hello?
Hi. What's your comment or question?
Hi there. I have just recently had a baby, and I'm wondering about hair loss with pregnancy. I've lost an exceptional amount of hair, much more than my hair is much thinner than even before getting pregnant. And I'm wondering when the hair will return, if it will return, and what medications I could possibly take while breastfeeding.
Doctor?
Well, I think it's a huge problem, and I see women all the time that have thinning hair because of pregnancy or because of the birth control pill. It certainly is a huge issue, and fortunately, probably 90+% of the time that hair will come back. About the only medication that you can use to restore your hair is minoxidil, and you can get, again, 2% you can get over the counter, but I'd suggest using a stronger. You can use 5 or 6% available through your physician, and that definitely will return your hair. If it's gonna, which it likely will, it'll definitely make it come back faster. The other thing that I have virtually all women with this sort of hair loss use are the cosmetic hair fibers. And all they are is little keratin fibers that you can put onto your scalp, and they make your hair, it's like makeup, and makes your hair look thicker. And it just gets you through that year when your hair is thinner before it thickens up with the minoxidil. And it's definitely very popular.
Thank you.
All right, thanks for your call. We're going to take a quick break.